Seizures are a broadly known issue among all sorts of people, but pseudoseizures have seemed to never be heard of. Today I'd like to inform you about two little-known facts about pseudoseizures, how they differ from epileptic seizures, and how they are triggered. Pseudoseizures are not the same as epileptic seizures. According to J.D. Haynes, pseudoseizures closely resemble epileptic attacks. However, they are a psychological illness and lack the paroxysmal electrical discharges from the brain seen in epilepsy. VEEGs are what are used to decipher if a person is having an epileptic episode or if they're having a pseudoseizure. A VEEG is basically where they put electrodes all over your brain, all over your head, and they put a video camera into the room. They record your brain waves and your physical appearance while you are having an attack, and then they can see the different chemicals in your brain and how they are reacting, and that's how they tell if it's a pseudoseizure. Another difference between epileptic seizures and pseudoseizures would be how they're viewed when in action. Stated by Powell, Hagen, and Korn in the article Treating Pseudoseizures and Related Behaviors in an Adult Male with an Intractable Seizure Disorder, in comparing supplemental motor seizures to pseudoseizures, Kanner indicated that tonic abduction posturing is not evident in pseudoseizures and that whipping movements involving only the head and neck are routinely observed during pseudoseizures, but not epileptic seizures. Basically what that means is that in a pseudoseizure, your arms and your legs flail around and your head and neck move, whereas in normal epileptic seizures, it's typically the arched back, tongue biting, and hand biting. So many things can trigger these pseudoseizures, but learning what triggers the patient is the key to learning how to prevent them. Pseudoseizures are triggered by life stressors that resemble trauma from their past. According to Elizabeth Bowman and Omkar Markand in The Contribution of Life Events to Pseudoseizure Occurrence in Adults, childhood trauma has often been associated with pseudoseizures. They found major childhood trauma in 55% of pseudoseizure subjects. Examples would be physical and sexual abuse, surgery, accidents, sexual assaults, childbirth, physical assaults, and head injuries. However, not all pseudoseizures are abuse-based. They can actually be nonviolent-based too. According to Bowman and Markand, they state that an example of nonviolent-based pseudoseizures would be families with double binds, which means, well, some examples would be a father who expresses anger violently and the mom minimizes the violence, families who avoid anger entirely, families in which the child was provoked or criticized and then severely punished when retaliated, like got mad, and families who emotionally rejected the subject during childhood. When pseudoseizures occur, the patient typically has no clear social problems and is usually an underlying issue that their subconscious can't handle. What that basically means is that you could be stressed out about something that happened forever ago, weeks, months, years, and you thought you had gotten over it, but your subconscious held on to that and your brain doesn't know how to function and you don't know how to handle your stress, so it releases in the form of a pseudoseizure. Treatments have been sought out and usually don't work as well because pseudoseizures, they're psychological disorders and they can't be treated like normal epileptic seizures can, so you have to take other routes. According to Powell, Hagen, and Korn, these treatments approached include behavioral techniques, hypnotherapy, environmental-related techniques, individual and family counseling, psychoeducation, neurofeedback, and medication trials. With all these different kinds of psychological techniques, patients can utilize, in the article More Controversies on the Treatment of Psychogenic Pseudoseizures, an addendum by Andreas Conner, talk about how his trial with 45 pseudoseizure patients, 13 of them stopped having seizures after they were diagnosed officially, and then 5 didn't receive any intervention at all. And after being observed through other studies as well, between 34 and 53% of patients with pseudoseizures became event-free over time without any therapeutic intervention. In conclusion, pseudoseizures aren't commonly known and can be hard to decipher from epileptic seizures. The VEEG testing, it's very expensive, and it can help provide treatments that are guaranteed to work because you find out if they are epileptic or pseudoseizures, and that depends on what kind of therapy and everything that you will need. The best case scenario for treatment of pseudoseizures after diagnosis would be finding your triggers and accepting your disease.